I'm so excited because today we're going to dive into one of our favorite topics. Of course, the microbiome is a subject we talk about a lot, but from a little bit of a different angle. We're going to dive into the microbiome's wide-spanning influence on metabolic health, the role of
Yes.
acromantia in promoting leanness and insulin sensitivity, the root causes of fat gain, and the practical advice for wellness practitioners to integrate these insights into their practice. So before we jump into acromantia, which I'm really interested in, will you tell us how you became interested in the link between the gut microbiome and metabolic health, please?
I actually, hard to believe, but I was overweight a lot of my life through my teens, my 20s, especially after I had my two daughters. I was like a typical celebrity mom kind. I just ate everything in sight and gained 70 pounds. And then it was quite a challenge, postpartum, losing the weight. And I found out that birth control affected my weight gain because as soon as I got off it, I easily did lose weight. And so the only time I was off it was either getting pregnant or postpartum lactating. And I found it was so easy to lose weight. And I really did see the role that pharmaceuticals have on women's weight gain. Women are right, or the men who drink xenoestrogens in their municipal water. Poor guys, right? Downing all the birth control through municipal water. So when I lost 50 pounds of weight, the last 5-10 pounds, you tend to regain and re-lose over and over and over in different cycles. And particularly during pandemic, I regained 10, 20. I got the COVID-19 pounds and then I had to lose that. So now I've really dug down different rabbit holes and perimenopause even, looking at ways we struggle with weight loss and weight gain and all the different reasons for weight gain. There's epigenetic. Now we have C19 and long COVID, long haul. And then the massive amounts of toxins in our food, air, water, wine, everything has toxins in it.
Okay. And so we tend to think about the microbiome and GI symptomatology. So I'm thinking we have practitioners listening and they say maybe stool testing is not indicated because their patients are free of GI symptoms. But I imagine you have something else to say about that. And you just touched on it. You talked about hormones, and that's just one piece of the puzzle, and toxic load. So I'm wondering, for example, what are the most common non-GI related conditions, signs, symptoms that you see that would warrant a stool analysis?
Just as Hippocrates talked about hundreds and hundreds of years ago, all disease begins in the gut. Little did he know, about the microbiome, right? And all wellness and longevity begins in the gut. If we look at a lot of the targeted, things that we do for longevity, it all starts in the gut as well. The gut is our largest source of hormones. It's our largest source of peptides. And as you know, I'm really into regenerative medicine and peptide protocols now. And, you can't beat a really healthy gut microbiome that pumps out these protective peptides that are regenerative. So we, look good and lose weight easily, have satiety, like the GLP-1 agonist peptides, tirzepatide and dual agonists and semaglutide and others. So it really is the gut. And so let's say 3 signs that people might have, even though they don't have outright overt gut problems, like bloating or gas, burping, diarrhea, constipation, but they can have brain fog, fatigue, or fat gain. And we help people at our Gut Institute to reduce these in 6 months or less. And it's not hard at all because I focus on the gut, but the gut's not everything. Because once things go awry, we have this it's like a domino effect, the adrenals and HPAT axis, that stands for hypothalamus, pituitary, adrenal, thyroid, and thymus axis, they just shut down. We go into 2 different channels of life. One is high fertility, great hormones, great adrenals, great gut, right? And then we go into another channel. I call it fucked. So we have fertility or fucked. You might have to bleep that out. And we can't actually have both, as you guys know. You probably help people, right, with infertility, men with low T or women low P.
It's a huge issue right now.
It's huge. And it's sad because this is the first time in human history, children, teens are dying before their parents with age related conditions. And if they have really healthy grandparents, they're even passing away and getting old age diseases before their grandparents. It's the first time in human history. This is recorded. So we're seeing fatty liver, obesity, type 1 diabetes, heart attacks, heart failure in just teens, and a lot of cancers as well. It's all related to the gut. So it's
Okay.
brain fog, body fat, fatigue, but then all these chronic age-related diseases.